All right. Welcome, YouTube. This video is going to be about enrolling in Medicare online. Some people are able to do it in person with an agent. You can't really go in person and knock on the Centers for Medicare, knock on their door, but you can do it online. You can do it assisted. You can DIY it. So I'll be showing you some ways to do that just based on your preferences. All right. Um, the main thing that I want to pull from, like I said in videos before, I will always pull from what you guys can see. There's no use in pulling up my dashboard and my agent portal and all the uh, computer programs that I have to, compare 9 different options at one time because you can't do that. And I fully understand and see where you're coming from on just wanting your hands on the process a little bit more, wanting your say in the process a little bit more. So that's what this video is going to show you. So I'll be actually navigating from Medicare.gov, the actual site where the commercials send you, where the state, wherever you're from, is going to send you, from where doctors send you. They send you to this site because this is like, the hub in getting straight from the horse's mouth, so to say. So let's go ahead and navigate there. But actually, before we do that, you may not hear this kind of advice from other agents, mainly because obviously we make a living. Here's how agents make a living, and this is mainly the brokers, not necessarily the captive agents. So not the ones like only representing, let's say, Humana, United. We are supposed to service the client throughout the year. So as you know, there's a bunch of you lovely baby boomers, and some of us have hundreds and hundreds and thousands of clients. So the service that we provide is kind of keeping you off the 1-800 number. Most of the times, we don't need to because there's not, a lot of problems. There are problems, though, that exist, obviously. So whether it be an Advantage plan or a supplement, your agent is supposed to, number one, reach out to you every year just to make sure, hey, how's your health? How is are medications changed at all? How you doing? So that's how we get paid. So we would love to take care of you. And I am speaking on, I say we, I don't know, I'll just speak for myself. Who knows? Because I know the kind of service I provide. So I would love to help you find a plan and assist you in comparing plans. However, if you are wanting to do this completely solo, you actually can. It's not advisable to do that. I don't advise it at all. And I don't think other agents would as well. But definitely, I mean, you have the ability to, on Medicare.gov, find your own plan and enroll in it without talking to an agent, without responding to a piece of mail, without going to a seminar, a webinar, without listening to anybody. You can have um, the ability to do that. So it's not advisable because of a couple of things. It's like saying, here's a pair of scissors, cut your own hair. Unless you have some kind of training, that could look like, at the very end of the day, a buzz cut, depending on how bad of a job you did. Or you can actually do a really good job and take the time to learn how to cut your own hair and do a pretty good job and save, I don't know, $50. You could do the same thing with Medicare, as long as you take the time to learn, the ins and outs of it, and enroll yourself in the proper plan. So you could do that. Most people don't. The problem is that y'all have been getting group insurance. Uh, Most of the people that I'm talking to, you've been getting enrolled in group insurance for your whole life, and there's like two plans to choose from, and you usually pick the cheaper one, or you pick the one that's. I picked the gold plan. It's the most. It looks like has the most coverage. I want to make sure I'm covered, and you usually just have two options in a county alone. I can come across 66 different advantage plans, not to mention, I don't know, 20 some odd different Medicare supplement companies that, okay, if plan G is a plan G is a plan G, that there's no difference in Medicare supplement coverage, then why is there so many options? And then, so what company do you pick? So all these questions should get bounced off an agent like myself. And what we do is, like, for example, did you know that there's household discounts? Did you know that there's roommate discounts? There's a fitness tracker discount if you've got a fitness watch. There's an annual billing discount. And so all of those discounts, though, are with separate companies, and that's on the MedSupps side. But even on the Advantage plan side, for example, like all my veterans out there, there's tons of plans for veterans that have TRICARE for Life, or maybe don't have TRICARE for Life, but go to the VA. But there's particular plans that give you something dollars, but I can't really give you because I don't know where you're at. But like here in Texas, San Antonio, Texas, there is a plan that gives you $125 back to reimburse you for your Part B, which we're in 2024. So your Part B premium is 174.70 if you are not a high income earner. If you are, it's probably a little bit more than that. So my point is, we know, because this is literally our job to know and to service. There's some things that put you in a better spot. So I'm going to advise you go with an agent. If you do not want to go with an agent, here's where to go. So let me go ahead and pull up Medicare.gov. Here we go. All right. So you type in Medicare.gov, you are going to see this screen. All right. So let's get started. Move this over here. Okay. All right. So here are, right off the bat, you could log in or create an account. You can find, and I'll show you how to compare plans. But for the purposes of this video, we're just gonna go over these first two blocks: log in, create an account, find healthcare plans. So let's go ahead and I don't even know, actually, because I've never created an account. I don't need to quite yet, but why don't I just create an account for, you've got to enter your Medicare information. So let's just say you are the one that says, wait a minute, I don't want to enter my personal information. I just want to see what's out there. That's okay. We're going to go a different route. So if you want to enter your information, you absolutely can and create an account. If you don't want to, here's what we do. We come out of there. Let's just come out of there. And let's go to find plans now. All right. I'm going to go ahead and type in my zip code. And then it'll ask you Medicare Advantage. Remember, Part C has A, B, and D in it. Okay. Medicare drug plans. This is your Part D. This is your drug coverage if you have original Medicare as your primary, a supplement as your secondary, And then you do need a drug plan so you don't get a penalty. Please don't be that person. Don't be the person that says, I'm healthy. I don't take any drugs. I don't need a drug plan. You will get penalized. Okay. Or a Medigap policy. Medigap policy is also known as a Medicare supplement. MedSupp, Medigap, all the plans, the G, the N, the K, those are all Medigap policies, and they supplement original Medicare. Okay, so let's just start off on the first one. We'll go through the other two in a little bit. So this is pretty cool. However, I always just say I don't get help from any of these drug programs. Not because, okay, if you do get extra help, if you are a dual Medicare, Medicaid, it's okay. I'll tell you what to look for, but I don't want the computer to show me filtered results. I want to see everything. And I know there's some of you out there, some of you boomers out there, you want to take control. I gotcha. So, do you want to see your drug costs? This one is okay. I have found some errors in the calculation of drug costs here, but it's a good start. Again, if you just want to see the completely unfiltered, you'll press no. If you want to select your drugs, you'll say yes. It'll take you into, and you just type in your drug, losartan, a lot of y'all are on that, add drug, and you can adjust your milligrams every month, every 2, 3, 6, 12 months, add to my list. Okay. But again, I'll see plans without drug costs. That way I get the absolute raw, unfiltered list of the top plans in 78258. So that is Bexar County. No, it's not Bexar for those of you that are outside San Antonio. That's how I can tell if someone's not from San Antonio. Where are you at? I'm in Bexar County. Whoa, it's Bexar County. All right, we are looking at Medicare Advantage, but check it out. Let's just say, let me come out of this and say, let's just say you're the person who says, I want to have total control. We're talking about Medicare Advantage. Okay. If you don't want to hear about Medicare Advantage, just forward through the video. There should be little bookmarks at the bottom. So let's say, yeah, I want the $0 plan. Yeah, Alyssa, I want the $0 plan. I want the dental, the vision. I want it all in there. I want the free gym membership. I want the food card. I want the over-the-counter credits, everything that Advantage plans offer. So, but I don't want to have a referral. I want to go, if my shoulder hurts, I want to go into the orthopedic, and I want to go there straight away. Obviously, it's my shoulder. I'm not going to go see my gynecologist for my shoulder. That's weird. So you go to the orthopedic. Now, that would be a PPO. You would want to have freedom to go without a referral, and not to mention you can go in and out of network. But pay attention. That is not to say that you're not going to pay more if you go out of network. I just sat with somebody and she says, well, what do you mean pay more? You just said I can go in and out of network. I said you can do it. You're not going to be rejected unless the doctor does not take Medicare Advantage. They may only take original Medicare, in which that's the rules. You got to play by the rules. So you got to go see another doctor. So if you're on a Medicare Advantage plan, you want to get into a Medicare Advantage plan, you have a PPO, it behooves you to go in the in-network doctors. So you pay less. You pay less than negotiated rate, the copay. Most of the times when you go out of network, and I can actually pull that up and show you guys, you go out of network, you will then be succumb to a percentage, which is a co-insurance. You don't want that. It's an option. Like if you're one of the ones that say, you know what, the gynecologist that I see, He delivered both my babies, and I don't want to go away from him. He just takes such good care of me. He knows me in and out. So, uh, that's fine. You can continue to see that gynecologist. Just understand any any move within the Medicare Advantage space, there is going to be a give or take. So the give is saying, yeah, you can see your doctor, your preferred doctor. The take is, well, it's no longer going to be a $30 copay. It's going to be a $45 copay. And that's that. That's the rule. So you got to play by their rules on Medicare Advantage. So going back, so you can select HMO or PPO. HMO just means you need a referral. Here's another tip is that a lot of the HMO carriers, you'll see this. HMO plans, my bad, I misspoke. HMO plans will have a lower max out of pocket than a PPO. Let's go to a United Healthcare PPO. Going to find it. There's your, well, let's just compare it to Humana. So 57.50 in network, in and out of network, 89.50. That's your max out of pocket for a PPO. Remember, I said that there's give and take. The max out of pocket is 3,800 on an HMO. So what does this mean? This means that on an HMO, the carriers will say it's managed care. So the plan says, I will lower the max out of pocket. And by the way, the max out of pocket is the maximum you will spend in a year if you have multiple copays. So multiple specialists, multiple surgeries, multiple hospitalizations. A really bad year happens. Your exposure is capped at 3,800 or the max out of pocket, the MOOP. That's what I'm going to call it, the MOOP. So in the MOOP, your max, the MOOP is lower on an HMO because the plan looks at it and says, well, in order for this person to go see the specialist, which it's going to cost a little bit more to go, the company a little bit more for you to go see a specialist, but they're only going to go if they have a referral. So it's like the PCP is the quarterback. You're going to run that route and throw the ball there only if I say so. And it's a safer option for the company. So the max out of pocket will be lower on an HMO. It's higher on a PPO. Again, give and take. They're going to give you that freedom because you can walk into a specialist and get an appointment without a referral and potentially see 9 different cardiologists, causing the company a lot of causing a lot of money on their part to cover you because they got to meet you halfway or a percentage. So my point is that on an HMO, HMOs are always going to have more dental, more vision. They're going to have more of those ancillary benefits. They're going to be a whole lot richer on an HMO than a PPO. Okay, enough of that. So we can filter out HMO, we can filter out PPO. And so these are all the companies that are in the Bexar County area that are represented. What we're filtering it by is the lowest drug and premium cost. You have the options of other filters. Okay. If you are getting a Medicare Advantage, you need to make sure you have drug coverage somewhere. So I would go to this right here and put includes drug coverage. There are MA plans that don't have drug coverages. And those are special cases. Either someone has drug coverage somewhere else, it'd be like TRICARE for life, or they want an MA plan separate from their drug plans. Most of the times, it's just a better situation if you have a MAPD plan, Medicare Advantage Prescription Drug Plan. So I just filtered it out. Look how many plans, 48 plans. Okay, we're going to keep going just for sake of time. And this is how it is. So, I mean, United Healthcare has 2 plans in the top 2. And you can add to compare. You can add to compare. Let's put another HMO in here. So let's just compare. My dog is dropping this ball right at my feet. Okay. So this is really cool. It will compare plans for you. So what's the difference between all these plans? Let's find out. So looks like there's a slight difference there. And when you click on plan details, it actually goes to the plan's website. So that's nice. But look, the dark blue button says enroll. There you go. You can enroll by yourself. So it will highlight the differences. And here they are. So it's like 70% correct, because most of the times there's not a range. It's an actual copay. Now, one of the things that is pretty spot on is going to be like the ones that are without the hyphenated. So you can get a pretty good picture and say, oh, okay, well, here's a main difference. But you also have to look at, okay, well, why is this one a little bit, it's more than this one and this one? Well, because I know these plans, the AARP Medicare Advantage, this plan has more dental than this plan, the Secure Horizons. Secure Horizons is really good for a frequent flyer, urgent care, ER, lots specialist. Someone's maybe got a chronic condition. They want to make sure that they're taken care of. I would probably go with the Secure Horizons. But get this. Some people maybe have diabetes. None of these plans are good for diabetics. There's actually a plan that is called a chronic special needs plan, aka CSNP plan, thrown around by us agents, that are for chronic conditions like diabetes. Also for people who have had heart stents, brain stents. So this is where having an agent comes into play, where an agent can actually save you some money. Again, if you're that person that doesn't have that and you just say, look, I just need a plan, I don't, and boom, AARP came up first, I'm going to enroll in it. Go for it. Make sure you understand your plan. So you can go into either Enroll, and just to let you know, they're gonna ask for your Medicare number. They're gonna ask for other sensitive information. So expect that. You can go into plan details, and it'll go into detail, specifically this plan. Now, Medicare.gov won't tell you, like, for example, the dental. Dental's a really hot topic, so I'm gonna go into that. So it just gives this particular, like, coinsurance and copays. But let's just say you want to see what the actual benefit is. Let's just say that you're one of those that's like talking to your friends and you're like, oh, I've got 3,000 in dental. How much do you have? And you have no clue. And you want to make sure you actually know the amount. Go to plan website. Right. So from Medicare.gov, you can go to the actual plan website. And this is also something that I recommend, because the premiums, the copays, you're going to get more exact rates here. So you type in your zip code. Now, this is something cool. You could actually, you can do you can look here, but you can also look at all your options. So Medicare Advantage, you got SUPs, you got your PDPs and special needs plans. This is where the chronic plans and the dual plans hang out. If you get a Medicare supplement, don't forget to add on your drug plan. So, but I had pointed out Medicare Advantage. We were looking at the HMO. What the heck is the difference? So we were looking at this plan, Secure Horizons, and this plan. Well, let's see what the difference. Oh, that's not what I wanted. It is what I wanted. But did you see something? Did you see that there was another plan that came up first on the United Healthcare page, but it wasn't first on Medicare.gov? Why is that? Well, when we had our filter on, it was filtering out low premium. This is $24. The other two are $0. But wait, don't say, I want a $0 plan. I don't pay anything. But why $24? What does this plan offer? Well, it looks like it offers the same copays as the frequent flyer plan. This is the plan, Secure Horizons plan for frequent flyers. Got really low copays for hospital. Got a really low copay for specialists. Because check out this specialist plan over here, $50 to go see a specialist. Now, this one here is $24 because it has more dental than the Secure Horizons. And it has the copays, the outstanding copays, I would say. These are pretty good for hospital. But if we go down to, okay, so, but why is this one $0? And why is the copay like so expensive? So let's go and see. Sorry, no, I'm jumping all around here. Let's go and see why. So you got your 24/1 on your right. And look at that. You can enroll yourself. Don't say I didn't tell you. But no. Okay. But, oh, this is why. Look at that. We just found a little minor difference that Medicare.gov did not immediately put up there. Wasn't as obvious as this. This plan puts $86 back on your Social Security check. It's called a Part B give back. Boom. There it is. So, like I said, in Medicare Advantage, there's give and take. This plan, there's give and take because a plan will have a feature on Spotlight. And if that feature serves you priority, and that is what you say is priority over medical copays, over ancillary benefits, then that's what you pick. So like this plan here gives you $86 back on your Social Security. And if that means more to you than saving $20 on a specialist copay, then that's the plan you choose. Okay. Let's point out another difference outside of the, okay. So you're saying, Alyssa, yes, $86 a month brings me more value than having a low max out of pocket. I understand that if all the worst happens to me, that I will be paying more in copays on this plan than on this plan. I get that. That's what I would like to hear. And that's also when you say that coming out of your mouth, you're reaffirming that option to yourself that this is the plan for me. And then boom, you enroll in it. Again, if you're just joining, I'm for agents to help people, to service people into their Medicare options. That's how us agents eat and survive. But if you want to, yes, the enroll button's there. You can do it yourself. So, for sake of time, I'm going to also recommend you go to the summary of benefits, which is found right here. If you're detailed Danielle and Danielle wants all the detail, click on evidence of coverage. I went ahead and clicked on summary of benefits. Okay, this is that $24 plan. The premium is right there. Right off the bat, doesn't say you have a deductible. There's your max out of pocket. Right. So use the Control F button on your computer to kind of search through this or thumb through it item by item. But I like it because it's like a McDonald's style menu. It really, the items on the left, the copays on the right, it's pretty self-explanatory. This is what you pay. So please don't be that person that says, I had a hospital stay and I didn't know that it was going to cost me so much money. They charged me $75 per day. Right there. Okay. So also, you can do Control F and find dental. So I love for my client, I ask these questions. So, Mark, are you going to have like any kind of dental work in 2024? His doctor told you, you know what? Yeah, I'm gonna have a crown. He said that there was a tooth that we're monitoring it, but in the next couple of years, we could definitely do a root canal, possibly dentures. Like those are kinds of things that you would definitely want to tell an agent. Those are the things I ask my clients because let me just say this right here. I don't like plan switching. Plan switching is not something I advise. Just because it better be a switch to save you thousands of dollars. Okay. Plan switching creates a lot of confusion, mainly on your end, not even for us. It's a simple switch, but that may be a reason to switch. If you're saying, look, I know that my plan, the reason why I got into it was for dental, but that's actually all done. And I'm going to have a scope coming up. And I have to have my copays as low as possible. So then I would bring up a plan that has, possibly lower copays. And we are talking about Medicare Advantage, possibly lower copays than another plan that specializes more in dental and the priority is dental. And they've made that benefit really high and sacrificed other benefits. So again, there's give and take in the Medicare Advantage world. In the next video, we're actually going to go over Medicare supplements, pulling it up on Medicare.gov. So definitely stay tuned for that one. I hope that this helped you out. You can DIY this. You can enroll in your own plan. Again, I don't advise it. It's like saying that, I can dye my own hair. It's just got to read the box and watch a couple of videos. Not necessarily. Okay. There's chemistry to it. There's things that us being in the industry, we know about. We know about discounts. We know about best customer service, things like that. So just pick our brain. Promise. You can even drop questions in the chat, in the comments section below. I love comments and questions in the comments. I'll try my best to answer you. But definitely hit me up. And if you got any questions regarding Medicare supplements, stay tuned.